Hey guys, Yulia here again with Card Chat. So in the last episode, I alluded to mineralocorticoid receptor antagonists, and so in this chat, we will go more into detail with that. So what is mineralocorticoid receptor antagonists? So MRAs are things that block the hormone aldosterone. So aldosterone is activated by angiotensin II, and it causes more sodium to be reabsorbed and more potassium to be excreted. So aldosterone binds to mineralocorticoid receptor on the kidneys, and then that activates a sodium potassium pump that allows more sodium to go into the bloodstream, which then elevates your blood pressure because water goes with it, and potassium gets excreted into the urine. So this is a good mechanism if you're in hypovolemic shock, bleeding out, or septic shock, and you need higher blood pressure. But this is not such a good mechanism in patients with heart failure who already have a really high afterload or a really high preload, and their heart cannot handle it. So we need mineralocorticoid receptor antagonists to block this mineralocorticoid receptor, which will then block aldosterone from binding, and this will block the reabsorption of sodium into the blood and excretion of potassium into the urine. So by blocking the reabsorption of sodium and water, we lower the blood pressure, and by lowering the blood pressure, we lower the afterload. And additionally, if there's less volume, because there's less sodium and water being reabsorbed, then in turn, we also have a lower preload, which helps with our heart failure symptoms. So examples of MRAs are Aldactone or Spironolactone, also eplerenone. And so both of these medications help to prevent this aldosterone from binding in the kidneys and prevent this reabsorption of sodium and water. The most common side effect or adverse effect of this medication is, again, that hyperkalemia, because by blocking this aldosterone, instead of potassium being excreted into the urine, it's being reabsorbed into the bloodstream and can cause life-threatening hyperkalemia and arrhythmias and possible cardiac arrest and death. So we have to be really cautious with this. So that's a short and sweet presentation on MRAs, and I hope you enjoyed it. And in the next episode, we will cover SGLT2s, which are actually diabetes medications, but it is important in heart failure, and you will learn why in the next lesson. So I hope you join me. Thank you.